my name, then I saw his face. Yes, I've seen his eternal glory. Felt his hand when I was astray. Until then, what is love truly meant? I was lost, but now I'm found by his grace. By his grace, by his grace. I've been saved by the grace of my Lord. By his grace, by his grace. I've been saved by the grace of my Lord. He is the Lamb and he is the shepherd. He's the burning flame within my soul. My heart and mind. He is my joy. He is my song. He is right when all is wrong. He's my savior.
We will start in 5 minutes. In a few minutes, just waiting for people to join.
It is narrow and a winding path, but he is always there through hope and despair. And when I'm lost, I'm always found by his grace, by his grace, by his grace. I've been saved by the grace of my Lord. By his grace, by his grace. I've been saved by the grace of my Lord. He will never let me down. He's always there.
Two more minutes before we start. One more minute before we start. All right, so it is 5 minutes So I am going to start. Okay, so we're going to be talking about sickle cell disease today. Don't forget to let us know where you are watching from, please. Let us know where you're watching from. Let me know if you're hearing me well. Today, again, we're going to be talking about sickle cell disease. So I waited 5 minutes, so we are going to go ahead and start. Okay. All right. So we're talking about sickle cell disease. So, what is sickle cell disease? If you have any questions, please just hold on to your questions, leave it, write it down. We will deal with all the questions at the end of the presentation. So sickle cell disease is a group of inherited red blood cell disorders. I'm saying a group of inherited red blood cell disorders because we do have different types of sickle cell anemia, which we are going to just briefly a little bit talk about it, just so that this life is not too long. So the main characteristics of sickle cell disease is that it is characterized by the presence of hemoglobin S. Okay, so a normal red blood cell, a healthy red blood cell is like round in shape, but with sickle cell disease, there's a farm tool where it got its name from, called sickle farm tool, because the sickle cell is shaped as this tool. So that's where it got its name from, sickle cell disease. So again, healthy red blood cells, and you can see here, this is a red blood cell in a healthy cell. It is round in shape, but in sickle cell, it looks kind of like a hook, like an S almost, kind of. It is thinned. So red blood cell help us to deliver oxygen with the help of hemoglobin. Okay, hemoglobin is a protein that is attached to red blood cell, and it helps us to carry oxygen to all different parts of the body. And the problem again with someone that has sickle cell is that it looks like kind of like a C shape. And because of that, it dies early. It dies early because it gets stuck in the vessels of the body. It's not able to travel freely as it should. Okay, because red blood cell again is round, it's able to flow freely through the blood vessels. But with sickle cell, because of its shape, it's not able to travel freely. So all most of the times it will get stuck and clogged in the blood flow, and this is what leads to the pain and other serious health problems that people with sickle cell have. One of them is the acute chest syndrome. We're going to talk about it some more in another slide. So again, this is when we say that people have crisis. Okay, when people have crisis in sickle cell is because of this shape and the fact that it gets clogged in the blood vessel. So, how prevalent is sickle cell? So, sickle cell was first identified in West Africa. And if you're from West Africa, Sierra Leone, Nigeria, Ghana, you will know that sickle cell is very, very prevalent there. Most Nigerians know a lot about sickle cell. But even in US, more than 100,000 people that live in US, mostly blacks, um, do have sickle cell, and it's also very common among people of the Mediterranean region, Indian, Middle East, and Hispanics. So West Africa, Mediterranean region, Indian, Middle East, even Hispanics are very, very common. So someone asked me um, in the group chat of this sickle cell class, someone asked me, why is it so common in blacks? So, and I said, it's not only in blacks, again, it's among Indians and Middle East, but nobody really, really knows. And honestly, I search and it's like there is no definite reason why it's very common in black. The only thing they can link it to is malaria. Okay, because of course in Africa we have a lot of malaria, and there's this link between malaria and sickle cell disease, but definitely they don't know exactly why. So now let's talk about the types of sickle cell disease. So number one are the people that have hemoglobin SS. So these people that have this form of sickle cell disease inherit two sickle cell genes from each parent. And in the next slide, I'm going to explain it a bit more. This is what we commonly call sickle cell anemia. And again, in most people from Africa, like Nigeria, this term is very common, SS and AS, okay, because people, we know the gene, okay, the SS and the AS. So people with the SS gene are the ones that have the most severe form of sickle cell, and that's because they've inherited. So both parents have the S gene, okay, and this child has inherited both the S gene from the parents. So S from one, S from the other one, and now has SS. So that's the most severe form of sickle cell. Now we have the hemoglobin S beta thalassemia. This is a form of anemia, okay? So in this person, they've inherited one S gene from the parents and another type of anemia gene known as beta thalassemia. So there are two types of beta thalassemia. I'm not going to go into it. There's O and the positive. But those with the hemoglobin S beta O thalassemia usually have the severe form of sickle cell disease. And the others with the hemoglobin S positive thalassemia, they have the milder form of the sickle cell disease. And of course, we all know about the trait, which is the AS, okay? Remember, I mentioned the SS and the AS, a very common term with people, for people that are in Africa. So with the sickle cell trait, this means that this child has inherited one sickle cell gene, the S1, from one parent, and a normal gene, which is the A, from another parent. So we have two different types of gene, AA, AS, of course, three, AA, AS, and then there's the SS. The SS is the first one we talked about. This person has inherited two forms of the S gene, one from one parent, one from the other parent, and now has SS. With the trait, this person has A from one parent, S from the other parent, and now they have AS. So they are called carriers of the trait. So people with that are carriers usually do not have any signs of the disease. They might have maybe a mild form of anemia, and that's it. And they usually live a normal life, but they can pass the trait to their other children. So definitely there's still a possibility of passing this trait because remember you have AS. So you can still pass the S gene to the other child, to a child. The next slide tells us a bit more about this gene. So if you look at this person, the pink guy here, this pink guy has two normal genes, which is the AA, okay? And now has gotten married to someone we call a carrier, okay? That has a sickle cell trait. The person has AS. So if they have four children, they have a 50-50% chance of their children having a normal gene and a sickle cell trait. Okay. So this child, this parents, two of the children may have normal gene AA, and two of their children may be carriers of the trait AS, AS. So it is very okay for someone that has nothing, has normal gene to marry someone that has a trait. Okay, because although their children can be carriers, but they're not going to have the disease. Now, going over to this side, if let's say someone that is a carrier, okay, AS, marries someone else that is also a carrier, okay, AS married to AS. Now, there's a 25% chance of this people's child having a normal gene, a 25% chance of one child having a sickle cell, and then two children having being a carrier. So one of their children, if they have four children, one of their children may be totally fine, no problem. They picked A from this parent, A from that parent, and they have both AA. But there's also a possibility that one child may pick A from this parent, S from the other parent, and they have they'll be a carrier, so they'll be AS. There's also a possibility, a high possibility of a child picking S from each parent, S from this parent, S from the other parent, and now being having the disease itself. So now this child will be child with sickle cell anemia. So completely will have the disease. Now we are going to talk about the diagnosis. I think someone asked a question, how do one find out if you are a carrier? It's simple, it's genetic testing, okay? So sickle cell disease is diagnosed with a simple blood test. Okay, it is most often though found at vet at routine newborn screening because here, and I'm pretty sure now back home, because people now know so much about sickle cell, they also screen babies at birth in the hospital. You can even get what is called a prenatal testing. That means when I'm pregnant, I can find out if my child has sickle cell. So, for example, when I was pregnant with my last baby, I opted for this test. So this test is usually done within 8 weeks of pregnancy. Okay. So, and it not only tests for sickle cell, it will test for other types of genetic disorders, Down syndrome, different types of genetic disorders. Okay. So you can find out if your child has this disease. But of course, they're going to tell you it's not 100% guaranteed, but at least you'll have an idea. So during routine newborn screening, so at birth, a child will get a newborn screening and they will get a repeat one within 8 to 10 days of life. So by the time this child is 8 days or 10 days, they will get a second newborn screening. And newborn screening checks for different metabolic disorders, and one of them is sickle cell. So, because children that have sickle cell are at increased risk of infection and other problems with their health, early diagnosis is very, very important so that treatment can be started early. So, the most common, the one that definitely confirms the diagnosis of this disease is called hemoglobin electrophoresis. So, again, it's a simple blood test. It's going to check your hemoglobin, hematocrit, all of those things. And then at the same time, is going to identify other hemoglobinopathies like sickle cell anemia and beta thalassemia. Okay, so this important test, hemoglobin electrophoresis, is the one that is going to definitely diagnose a child or an adult of this disease. So, what are the symptoms of sickle cell disease? Mostly, it starts showing in the first year of life. Remember, when a child is born, they get blood supply from the mom. Okay, they get blood supply from the mom, and inside when the child is born, that blood supply is still there a little bit. The child is still carrying that, but by the time they hit 5 months to 6 months, that supply start dropping. Okay, so now they have to make their own RBC, and that is why most of the times you notice that symptoms within 5 to 6 months of age, because that's when the child will start making their RBCs. And if they are making sickle cell RBCs, that's when you're going to start noticing symptoms. So sickle cells break apart easily. A normal red blood cell lasts about 120 days. So your body automatically will recycle your red blood cell every 120 days. But the problem with sickle cell is that they die between 10 to 20 days. So that means the body has to keep making red blood cell. But because that's not the normal way the body makes red blood cell, this person will have a shortage of red blood cells, which leads to what we call anemia. So one of the symptoms is anemia. Another symptom is episodic pain. So someone will develop pain because, again, we talked about the sickled shape of the red blood cells. Because it is sickle shaped, it's not able to flow freely through the blood vessels. So what happens is that it gets stuck. Because it gets stuck, there's no blood supply to that area of your body. The cells in that area lack oxygen supply. They're going to start dying, and that's what causes pain because the blood is not able to flow freely in. That's what we call vaso-occlusive um, syndrome. So vessel, your blood vessel, occlusive, clogged. So vaso-occlusive, your blood vessel is clogged. And again, acute chest syndrome because the tiny blood vessels in the heart is not able, the blood is not able to flow through the tiny blood vessels in your heart. It causes chest pain. Well, that's what we call acute chest syndrome, and it can lead to stroke. Another symptom is the swelling in the hands and feet, also known as dactylitis. So, most common in children. The sickle cell shape, again, it gets clogged because it's not able to flow. That side gets, especially the hands and the feet, they start swelling up because the red blood cell is blocking the circulations in the hands and the feet. Another symptom is frequent infection. Because what happens is that sickle cell damages the spleen. What does your spleen do? Your spleen gets rid of infections. That's why anytime you're sick somewhere, the area sometimes around it, that's what we call the lymph. The spleen is able to produce your lymph, works with your body to clean up infections in your body. So if sickle cell damages your spleen, then there's a increased risk of you of that person having infection because the spleen is not doing its job. The other problem is vision problem. Again, your eyes have such tiny, tiny blood vessels. So because the red blood cells can become clogged, okay, with sickle cells, I mean your vessels in your eye can become clogged with sickle cell. This can damage the retina of your eye. And the retina is the portion of your eye that processes visual images. Your ability to look up and see a light and read signs and see diagrams is the job of the retina. So if your retina has is damaged because of red blood cells behind your eyes being clogged, then you're going to start having vision problems. You're not going to be able to see well. Treatment options. So, what are the treatment options for sickle cell? Again, there is no single treatment that is the best, that is one and for all. Okay, so treatment is based on the person. How frequent is this person having crisis? How frequent are they having infections? So the treatment is built based on what's going on with that person. One of the common treatments that you will find is penicillin V. This is to help prevent the child from having frequent infection because what did we say? Sickle cell destroys the spleen, an organ in your body that helps to get rid of infections. So this child will have frequent infections. Penicillin will help to prevent the child from having infection. Penicillin is usually given to children from birth to the age of 3 at 125 milligrams twice a day. Children that are from 3 to 5 years will get 250 milligrams of penicillin twice a day. And by the time they get to like 6 years, that medication can stop depending on what's going on with the child. Again, remember that treatment is built based on the child. Okay. The other treatment that is very common is hydroxyurea. This is a medication that helps reduce frequency of painful crisis. So it helps the red blood cells to flow a little bit easier. And because of that, it may help reduce the frequency of transfusions and hospitalizations. Because with sickle cell, remember again, the red blood cell is sickle shaped, it gets stuck, it dies easily 10 to 20 days instead of 120 days. Such people require frequent blood transfusion. But this medication, the hope for it is to reduce the risk of infection, reduce the risk of you having too much blood transfusion, and it's taken daily. But if you're pregnant, it's not um, you can take this medication. It's not advisable because it can affect the fetus. The other medication is Oxpreta. This is a more common recent medication here that is being used for sickle cell. Again, it's used in children and adults, but the child has to be 12 years and above to use this medication. It can lower the risk of anemia and it can improve the blood flow throughout the body. Side effects of this medication include headache, nausea, diarrhea, fatigue, and fever. Another common form of treatment is not treatment per se, but this person will need pain medication because of the pain caused by the clogged blood vessels. So you will see that when they go to the hospital, they require frequent IV medication for pain control or even oral narcotics for pain control. At this point, at this very moment, the most common, the only cure for sickle cell disease is what is called a bone marrow or stem cell transplant. So your bone marrow is a very soft fatty tissue that is at the center of your bones where your blood cells, where your RBCs are made. So what happens is with someone that is okay that has a normal AS, a bone marrow transplant or stem cell transplant is a procedure that is going to take the healthy cells from this person that is normal, which is known as the donor, and transfer it into someone that has sickle cell. Okay, so someone with sickle cell, they'll take these bone cells, bone marrow cells, and transfer it into this person. Um, this procedure is very, very risky and can have serious side effects. And also, it can be difficult to find a match. For someone to be able to do this for you, they have to be a really, really, really close match. And it's usually like a brother or a sister that can be able to do this for you. It can lead to death, it can be very serious, but it is the only cure for sickle cell at the moment. So, what can you do? Okay, if you're a parent, if you're an aunt, or someone that knows someone that has sickle cell, the number one thing first is get genetic testing. I am so impressed because right now, most churches in Nigeria and other parts of Africa, part of their counseling, pre-marital counseling is getting genetic testing done. Why is this necessary? Because it will prevent all of this. And this is not to like bash anyone that has a child with sickle cell or anything like that. But if you are a parent with a child that has sickle cell, you know that it is so hard for you to see your child go through this. I have seen it. It's not an easy thing. Parents feel guilty. They feel overwhelmed because you see your child suffering, and as a parent, you just want to take that suffering from them and just say, "Only if I can take your pain from you." But of course, you're not able to, unfortunately. So the best thing, the very best thing to do for your future child is to get genetic testing to make sure that you guys are a good match to get married. Get screened. I talked about newborn screening. So if you're pregnant, you can get prenatal screening. That's even before you have your baby. You can also get screened when the baby, as soon as the baby is born, they can get screened because, again, treatment and finding out early is very crucial so that this child can live a healthy life. Make sure that your child maintains hydration. If it's you, make sure that you maintain hydration. Um, Again, remember that with sickle cell, the blood gets stuck because of the shape of the hemoglobin of the RBC. So you want to make sure that you're drinking water because when you're hydrated, it just makes everything flow easily, flow through easily in your body. So most of the common cause of crisis, painful crisis, when we say sickle cell crisis, is dehydration, especially in a school age child. They go to school, they're playing under hot sun, and they're not drinking water. Remember that when you're sweating, you're removing water. That sweat from your body is the water out of your body. So if you're not replacing that water, there's a problem. You can get dehydrated. So send your child to school with a bottle of water. Make sure that when they come back, that bottle is empty, not because they poured it out, but because they actually drank it. Make sure that your child's school is aware of your child's illness so they can remind your child frequently to drink some water. Have a sick day plan that includes immediate treatment. So if you're a working parent, make sure that your job knows I have filled this form several times for parents for different things. So if your child is someone that would maybe need frequent hospitalization or can get sick at any time, make sure that your job knows, make sure that it's documented. You have a form filled out to say that at any point in time, you can be called to leave work, and that is not going to count against you because of because of the situation in your personal life. But make sure that you're not taking advantage of that because what's going to happen is if you're taking off saying, hey, my child is sick, and you're taking off when your child is actually sick, it might be a problem. So make sure that you're leaving it and actually using it when you need to use it. Make sure that your child's school is aware so that they can also know um, uh, this will make me jump to the last point to recognizing symptoms of complication early. After you take this class, you should be able to know the symptoms to recognize it so quick. Teach your child's teacher. You can educate your child's teacher on sickle cell and teach them the signs and symptoms so that even the child's teacher, if they see these symptoms, they can recognize it early and they can call you early. They can get your child the help that they need. Make sure your child's immunization is up to date. Again, anything that attacks this child is a risk. Okay, it can put this child at a high risk of infection, of disease. So make sure that this child is immunized. Their immunization is up to date, especially pneumonia. Okay, that's why remember that's why they're taking penicillin to prevent infection. So make sure that your child immunization is up to date. Make sure that this child is getting good nutrition, fruits, vegetables, drinking water, eating healthy, exercising. Um, I just did a video recently that I'm about to put up. It's not up yet. So at this point, I'm just going to tell you if you're not subscribed to our YouTube, please subscribe. Like I do a lot of teaching on YouTube on common childhood illnesses, adult illnesses. So make sure that you subscribe, turn on your notifications so that you know when I upload a video. I did a video that I'm going to post soon about tips for picky eaters. So if your child is someone that doesn't really like eating healthy, there's so many things that you can do to help your child to get the required and proper nutrition that they need. Avoid smoking. Again, I've talked about smoking so many times on my YouTube channel because what smoking does is it constricts the blood vessels. This child or this person already has problems because your blood is not flowing freely as it should. So now you adding smoking, which constrict blood vessels. So now you have double problem. So make sure you're not smoking, and even your child, that you're not smoking around your child, because there's something we call secondhand smoking. Even though your child is not the one that is smoking, but if they're inhaling your smoke, they're technically breathing that thing in, and it's going to do the same thing that it does to your body, it's going to do to this child's body. So do not drink alcohol, because I've talked about alcohol before. Alcohol destroys the filtering system of your kidneys, and again, it causes dehydration. If any of you on this trip is someone that drinks alcohol, you will know that if you drink alcohol, your mouth gets dry if you drink a lot of alcohol. That's because alcohol causes dehydration. And what leads to painful crisis in sickle cell? Dehydration. So you want to keep your body hydrated. You want to stay away from drinking alcohol. You want to stay away from smoking, because smoking clogs with constricts your blood vessels. Recognize the symptoms early. You already talked about the symptoms. You want to recognize early so that you can give your child treatment early. So the next slide is a case study. I'm going to talk about the first one, and the second one. I would actually like someone from the stream to take this on and tell me what's going on, if they had a child or if they know someone like this, what they would do about it. So the first one is a 3-year-old male. This male child is a native of Jharkhand, Central India, presented with mild pallor. Okay, so pallor basically means like the lips probably are blue because of lack of blood supply, lack of oxygen. Icterus means yellowing of the eye. Okay, so like jaundice, and history of on and off abdominal and joint pains. So on examination, the child has mild splenomegaly. So what do we say about the spleen? Cleans out infection from your body. So this the splenomegaly means that this child's spleen is enlarged. So he's had two history of prior hospital admissions. The first one was at the age of 1 when he was diagnosed to have pneumonia. So first one, he went to the hospital at the age of 1. He was diagnosed with pneumonia, given medication, sent home. The second one at the age of 3, and 3 months prior to coming to our institution, has fever, anemia, and jaundice. This child has had 3 different blood transfusions up till now. The last blood transfusion was just 3 months back. And there is also a history of sibling death at 5 years old. So that means this child had a sibling that died at the age of 5 due to fever. So what I would say here, definitely this is not happening and should not be happening at this day and age, because number one, this child was sick at the age of 1 year, okay, and has been going to the hospital frequently and is now 3 years old with fever, anemia, jaundice. These are the classic signs of sickle cell. Blood transfusion. If a child has to have 3 blood transfusions, that should trigger someone to check this child for sickle cell, to do more tests and find out why this child has anemia so much that they would require transfusion. So this is just a no-no. This child should have been diagnosed since the first time they went to the hospital. So the second one, if anyone wants to take this on, please take it on. I can address it later. But if you want to take it on, please just put it on the chat that you want to answer this question. Like, not really answering, but just say what you would have done. So this one says that a 6-month-old boy with no previous medical problems. So this boy has not had any issues since birth and is 6 months now. Comes to the hospital with fever and painful swelling of the hands and feet. Okay, so his parents are concerned because this boy has been inconsolable for 6 hours. That means he's been crying non-stop for 6 hours. The infant has been refusing bottles and has needed fewer diaper changes over the last 2 days. Of course, if he's not eating well, he's not going to pee well. So no wonder he doesn't need changing frequently. So the family also recently moved from El Salvador without established pregnancy and neonatal screening. So if you were to, after listening to what I just said, if you were to come in contact with this child, what would you say is going on with this child? Anybody want to take on this question? And if you want to get on the live stream to ask your question, please indicate and I will post the link. Actually, let me post the link so that anyone that wants to come in to the live stream and ask their question, they can click on the link and join. I will put you in. So, anyone want to talk about this 6-month-old child? No? Okay. All right. So, I'll talk about it then. So this boy is 6 months, right? What did we say about sickle cell? We said that it normally shows between 5 and 6 months of age because at this point the fetal hemoglobin, that means the hemoglobin that this child got from the stomach from mom, has started depleting. Okay, it started dropping. So now this child has to make their own red blood cells now. And because they're making sickled red blood cells, it's not going to be normal. It might get clogged. It might cause pain because now it's clogged. So this child comes in, has not had any problems before, and now has painful swelling of the hands and feet. We talked about dactylitis, um, which is painful swelling in the hands and feet because, again, the sickle cell is clogged in the red blood cells and it's causing swelling of the hands and feet. His parents is also concerned because the child has been crying for 6 hours. This child is in severe pain because again when the cell, red blood cells, when the blood vessels is clogged with sickle shaped red blood cells, there's no blood flow, the hands are swollen, there's no oxygen supply to that area, so it causes severe severe pain. So this boy has been in pain for 6 hours. Okay, so now, of course, if you're in pain, who thinks about food when they're hungry? Even babies, they don't think about food when they're hungry. So I mean, they don't think about food when they are in pain. So, and then if you're not eating, you're not going to be making anything. You're not going to be peeing because what are you peeing? Okay. And the fact that this boy is not drinking any formula, not eating anything, is even making it worse because now it's going to lead to dehydration. Okay. So they need fewer diaper change for the past 2 days. So the parents don't even know the signs because at this point, if they knew, this child would have been in the hospital. And then to top it all, they come from El Salvador. And we talked about the Hispanics, which is another area with so high prevalence of sickle cell, and they did not do they don't have any report of newborn screening. So we are just meeting this child that just moved over here, no newborn history, so you don't know. So the first things first is you're going to test this child. First thing first, hydration, pain medication to help this child, IV fluid to get the blood flowing in this child. They're going to check this child for sickle cell. This child probably has anemia. It's going to probably, depending on how bad the anemia is, the child may or may not need transfusion, but you want to get the child hydrated, you want to get pain control, you want to get this child properly diagnosed, started on medication like penicillin to prevent infections. Now the parents has to be educated on the fact that this child has sickle cell and also the things that they need to know, because this is a lifelong disease. So now they have to be prepared. They have to know what the plans are for the future, the things that I talked about, having a sick day plan, knowing the early signs and symptoms, and all the things, adequate hydration, nutrition, and getting the child up to date on immunization. Okay? So the next slide is questions. So anybody have a question, please put it on. So there was a question that I saw earlier, and it was how do one find out if you're a carrier? So I talked about this earlier. You find out by getting a genetic testing done. So when you go, they'll take your blood and they'll test you for sickle cell, and that's when you'll know if you have sickle cell or if you're a carrier. Simple. The electrophoresis is going to tell you if you're a carrier. If you have AA, if you have AS, if you have SS. Of course, if you have SS, I'm pretty sure by now you would have known that you have sickle cell. All right. So, any other questions before I let you guys go? This is the end of my slide. Okay. Anybody have a question? And if you think of your question later, if you don't have any questions now, you think of it later, you can always send questions to me. You can send me a message on Facebook. You can get me on YouTube. Again, if you haven't subscribed to my YouTube channel, do well to subscribe. You'll get much, much more content like this. I have so many videos lined up, so many already on the channel that you can check out. Share this video to your friends and your families. Now that you've taken this class, I'm pretty sure that you're very confident now that you will be able to help someone that is going through this. Okay, it can be very, very overwhelming for both the parents and very hard for the child. So please, 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 um, okay, in your practice, how often do you come across children with sickle cell? Oh, because I work with pediatrics, very, very common among the blacks. I see it a lot. And the hardest part of it all is when you diagnose a child. So some I've had a child that say, oh, back home in Nigeria, they said I have sickle cell, but I haven't checked. I don't know. Probably most of the common reason is because of no insurance. Because I work in a practice that see everybody, whether they have insurance or not. You see everybody. So now you come across, I do the test, and this child does have sickle cell, and the hardest part is the fact that this child doesn't have insurance. That is where I get stuck. Like, my heart breaks. Like, the good thing about my practice is we have a program that you can help people that do not have insurance. So at this point, I will refer this child to hematologists. They are the people that manage this. I will manage the medication, but they have to have frequent visitations with the hematologist. So they need that appointment. But how do you help someone that do not have insurance? These are the things that I run into. So I do see this quite often in children, again, with Hispanics and blacks. This comes up a lot. Um, and again, the hardest part is not having insurance. Um, so I've had one that I call because as a provider, you also want to make sure that you are sleeping at night. So even when the child doesn't have insurance, there are so many things that you can do to help this child. There are free things from the hospital that you can try to get free healthcare. Some hospitals do provide this at a fee, that they can come in and see hematologists at a fee. Sometimes it's really expensive and they can't. My job has a program where they can be placed on what is called it's an assistance program that they have in conjunction with John Hopkins Hospital, that you can send a child to if they qualify. And to qualify, you have to show your income, how much you make. if you're not making much, then you automatically qualify and you have to have papers. Then they will send you to this specialist that will help you for free. But most of the time, these people live with people, other people, and the people that they live with maybe don't want to share their income with a company that they don't know. So if I say, oh, tell your aunt or tell your uncle that you're living with to come and submit this document so that we can see if you qualify, and they don't want to submit it, and that automatically disqualifies the child. So now you have to like come up with different other things that you can do. Sinai Hospital do have free stuff that you can help. I'm not really sure how it works back home, especially parents that cannot afford. I cannot even begin to imagine a parent that cannot afford to go to the hospital to pay for blood transfusion, to pay for the medication that this child will need every day. Again, this is why in the Speaks TV is coming to Nigeria. We're going to do free healthcare, and we are mainly focused on children because we see a lot of health fairs for adults, but we don't see a lot for kids. And that is what we are coming to do. We want to focus on children to get them screened and get them aligned for the appropriate care that we need. So check out our website in the6tv.com and join our YouTube channel. You need support. So by subscribing to our YouTube channel, you're supporting us. By watching our videos, you're supporting us because all these things we have to come up with the resources by ourselves because of course we are going to people that do not have. That's the whole point. You're going to help someone that don't have the resources that they need. So of course we need the support that we can get as much as we can get it. That's why we're doing all these things so that when the time comes, we can actually get the support that we need to go and give this free health screening, diabetes check. There's a very, very common type 1 diabetes in children that some of them don't even know. Wound care, different type hypertension in children, very common. People don't even know. Um, very, very important that we help children because we help a lot of adults, but we forget the children. How vital it is for people to get tested before marriage without any symptoms or signs. So remember when I talked about AS. So people that have AS, that means they took one sickle cell gene, the S, from one parent and took one normal gene, the A, from the other parent. So they are AS. And these people can live a normal, healthy life with no symptoms. But if you go marry someone that has, let me see if I can find the diagram again. If you go marry someone that has AS, so both of you have AS, there is a high possibility that someone a child will have sickle cell because both of you are okay, you don't have any symptoms, but you're actually a carrier. That's the set of people we call carriers. Okay, they have the sickle cell trait. So going back to this diagram, this is the usual gene. So this pink guy is getting married to this purple girl. So the pink guy has normal gene AA, and this girl has AS. This girl has no symptoms, so she doesn't know if she's a carrier or not because there are no signs and symptoms. She can live a healthy life. If she marries someone that has a normal gene, there's a possibility that two of her children will be a carrier. That means they will lead a normal life, no issues, and they're fine. And two of their children will have normal genes, no problem there. But if you did not know that you have this gene, that you're a carrier, and let's say you go and marry someone that is also a carrier, so both of you are AS, both of you don't have no signs and symptoms, so you both get married. Now, one of your children, if you have 4 children, one of your child may be completely normal. So they take one A from you, one A from your wife, they're fine. And two of your children possibly will take one A from you, one A from your wife, so both of them will be carriers. one of your child might have sickle cell because this child might pick S from you and S from your wife. Because remember, both of you are carriers, you both have the S gene. So might pick S from your wife, S from you, and they will have the sickle cell disease. So that is why genetic testing is important. So even though you don't have any symptoms, you're fine, okay, it's still good to get tested because there's that possibility of being a carrier and marrying someone that is also a carrier and giving your child sickle cell disease. Okay, so if there is no more questions, um, I will say adios for now, unless anybody has any questions that they want to ask. But if not, it was so good to have you guys. Thank you, thank you, thank you so much for joining me today. Keep your eye out for other of our lives. In 2 weeks, we are going to be talking about BBL. We are going to be talking about plastic surgery. Is it okay to have plastic surgery or not? I'm going to have a guest that day that is going to be talking about that because it's very common now. Everybody want to have a butt lift. Everybody want to have the figure eight. So should you or should you not do it? Join us in 2 weeks on the 21st. That's what we're doing. I believe it's at 10 a.m. or 12 p.m. I'm not sure, but that info will be out. I can't remember, but it's definite. Thank you so much for everyone that joined. I will see you guys in 2 weeks. Bye.